Welcome, everybody. My name's Jeffrey Hotch. I'm a professor of health economics, and I am the Associate Director for the Center for Healthcare Policy and Research. And it is my pleasure to welcome you. Also, we have with us Dr. Lyle. She's the Director of the Center for Healthcare Policy and Research. And we want to welcome you to our seminar series today. We have with us presenting Dr. Melanie Dove. Dr. Dove completed her BA at UC Irvine and her MPH at Boston University and her SCD at Harvard University. That's the UC Davis of the East. Dr. Dove is an assistant professor in the Division of Health Policy and Management in the Department of Public Health Sciences here at UC Davis. Her research focuses on the impact of tobacco control policies and what that impact might have on behavior. She also has an interest in survey research and teaches SAS classes to graduate students. Her talk today is called A Tale of Two Flavored Tobacco Sales Restrictions, California and Massachusetts. This talk will help us to, 1, understand the intended goals and unintended consequences of flavored tobacco sales restrictions. 2, describe the impact of flavored tobacco sales restrictions on youth tobacco use. And 3, describe the advantages of academic and community partnerships in policymaking. Dr. Dove, thank you very much for agreeing to speak with us today.
Yeah, I'm happy to be here, and thank you for the introduction. I will start my slideshow. Again, my name is Melanie Dove, and I'm an assistant professor in the Department of Public Sciences here. And today I'll be talking about 2 flavored tobacco sales restrictions in California and Massachusetts. And if you have any questions, please interrupt me. Happy to answer any questions. This is financial disclosure. I was supported by a KL2 award here at UC Davis for most of this research. So today I'll start by talking about trends in youth e-cigarette use, give a little bit of a background on flavored tobacco sales restrictions, and then I'll talk about the impact of these policies in California and Massachusetts on youth tobacco use. So I'll talk about local policies as well as state policies and talk about some of the unintended consequences of these policies. So e-cigarettes are the most widely used tobacco product among youth. What we are most concerned about is nicotine addiction. So youth who use e-cigarettes are 3 times more likely to start smoking cigarettes, which cause a range of different health outcomes, including 20% of all cancers. So this chart shows trends in e-cigarette use among high school students are the black lines, and middle school students are the blue lines from 2011, when e-cigarettes first became available, to 2018. And you can see in 2018, there was a very sharp increase in e-cigarettes among high school students. And this caused the Surgeon General to consider youth e-cigarette use an epidemic. So since then, e-cigarette use has decreased. This graph shows among high school students current e-cigarette use from 2020 to 2024. And we can see that there's a decrease, and this was largely due to COVID. So e-cigarette use is a very social behavior. And when schools were closed and students were stuck at home, they didn't have access to their friends, and e-cigarette use decreased. So even though it's decreasing, youth are using e-cigarettes frequently. 26% of users reported daily use. And what is also really concerning is that these products are getting bigger, stronger, and cheaper. So these products already had a really high nicotine content in them, and the nicotine content in these products has been increasing over time. And almost all e-cigarette users use a flavored product. Here we see that the flavored products often resemble food products that youth like to consume. And this isn't an accident. This is the tobacco industry markets these products towards youth. So one way to kind of combat this e-cigarette epidemic is to enact flavored tobacco sales restrictions, which prohibit the use or prohibit the sale of flavored products in retail stores. So this is a map of the US. And we can see it's showing local flavored tobacco sales restrictions at the city level or the county level. So we can see in California, there's quite a few, especially in the Bay Area. And the study that I'll talk about later focuses on these policies in the Bay Area. And we can also see over here in Massachusetts also has a lot of local policies. And we'll talk about some of those later as well. In California and Massachusetts, they've always been leaders in tobacco control policy. These states were some of the first to enact smoke-free air laws. And so it's no surprise that they're, one of the first to implement flavored tobacco sales restrictions as well. So this map, instead of showing local policies, this map shows the state level policies. So both California and Massachusetts have a policy that covers the entire state. And California's was implemented a couple years ago in December 2022. And the one in Massachusetts was implemented earlier in June 2020. And there's varying scales of comprehensiveness. And so we see here that other states also have state level policies like Maine and New York, but the state policies in California and Massachusetts are the most comprehensive, meaning they come the closest to banning all flavors from all tobacco products in all locations. So what do we know about flavored tobacco sales restrictions and youth e-cigarette use? There's pretty consistent evidence that they reduce the availability in stores and that they reduce sales of e-cigarettes and other tobacco products. However, less is known whether they reduce access and use of tobacco products. And these are really the key items that will lead to improvements in health outcomes. So we did a study to look at flavored tobacco sales restrictions and youth e-cigarette use in the California Bay Area. And this slide briefly describes our methods. We use the California Healthy Kids Survey, which is a really large survey of middle and high school students in California. It's administered by the California Department of Education. For example, there's about 500,000 students surveyed per year. So it's a really large survey. Our exposure was students attending school in a city with a flavor regulation versus without. And so we had the location of each student's school. So we couldn't tell what, we didn't have the location of where they lived, but we knew what school they attended, and we thought that was close enough to do this analysis. And our outcomes were current and ever e-cigarette use. Current is in the past 30 days, and e-cigarette use is, did you ever use an e-cigarette in, even one in your lifetime? And this ever e-cigarette use is designed to capture people who kind of just try it once or so. We also looked at ease of access to e-cigarettes and ever using marijuana in an e-cigarette. And we used a difference in difference analysis that compared the pre to post policy change in exposed students to a change in unexposed students. And this difference in difference methods are often used to examine the impact of different policies, and they're considered a very rigorous approach to do so. And so the studies that I'll talk about today, most of them use this difference in difference methods. So this is a map of the cities that we looked at in our study. This is the California Bay Area, and you can see San Francisco in dark purple. So the dark purple areas are those that had a flavored tobacco sales restriction, and we were able to include in our study. The light purple areas are cities that had a policy, but we didn't have data for them, so we couldn't include them in our study. And then we compared them with the cities in white that were the unexposed cities. This is a timeline of our study. So we looked at the following 7 different city level policies that were implemented either in the 18-19 school year or the summer before or after. And we compared outcomes the school year after policy implementation to the school year before policy implementation. And our hypothesis was that youth e-cigarette use would decrease following the implementation of a flavored tobacco sales restriction compared with youth not living in a city with a policy. So this is our hypothesis, kind of what we were hoping to find, that students living in cities with a policy would see this decrease in e-cigarette use compared to cities without a policy. And these are our results. We saw no substantial change in current e-cigarette use 1 year after flavored tobacco sales restriction implementation. So again, cities with a policy compared to cities without a policy. And before the policy is the dark purple compared to after the policy is the light purple. And there's very little change in youth e-cigarette use. So it did not follow what we were expecting from our hypothesis. And this is looking at ever e-cigarette use. Also very little change in both groups, pre to post policy in ever e-cigarette use. This next outcome is ease of access to e-cigarettes. So youth reported whether or not it was easy to access these products. And so in areas with and without a policy, there was an increase in ease of access. So these products, students are perceiving that it's easier to access these products. So especially in areas with a flavor policy, so ease of access increased after the policy was put in place. So we weren't expecting this at all. And there's a similar increase in both groups in using marijuana in an e-cigarette. So in both groups, pre to post policy, the percent of youth who ever used marijuana in an e-cigarette increased. And this table shows our adjusted difference in difference odds ratios. And here, looking at the association between flavored tobacco sales restrictions and each outcome. And here each odds ratio is close to 1, or if the confidence interval includes 1, means no association. So you can see that's the case for all of the outcomes, and all p-values are greater than 0.05, meaning not significant. So we saw no association between these policies and any of the outcomes we looked at. So in conclusion, no association 1 year post-policy among high school students in the California Bay Area. But we did see some pre to post policy changes among the exposed and the unexposed groups. So these products are getting easier to access, and also using marijuana in an e-cigarette has increased. So these results and conclusions do not mean that, these policies don't work. We only looked at 1 year post-policy implementation. We only looked at the California Bay Area, a very small, um, area. And also, they're part of a larger picture. So we need these policies, but we also need cessation tools and enforcement of the policies. So for our next steps, we wanted to see if there were subgroups where the flavor restriction was more or less effective. So we stratified, we did almost the same study, but we stratified by tobacco retailer density. So we chose to stratify by density, retailer density, because areas with high density have more exposure to tobacco marketing, tobacco ads. There's more opportunities to purchase tobacco because there's more stores. So there's greater access for youth and greater perceived access. And most importantly, areas with high retailer density are located in high minority and low income areas. So this is a map of California Bay Area, and in red, we can see where each of the tobacco retailers are located. And you can see for example, in San Francisco and Alameda has a very high density of tobacco retailers, whereas over here in Sonoma and Napa County, density is a little bit lower. And this map was created with this community health assessment tool, which if you haven't used this tool yet, it's a really great tool. It's just an online website where you can make maps like this, and you can overlay income or all these different variables that you can create maps with. So we looked at tobacco retailer density, and we looked at the number of retailers per square mile. And we created a variable with 2 categories, and the median of 3.3 was the cut point. So these are our adjusted difference and difference odds ratios for the association between policies and each outcome, and stratified by low retailer density and high retailer density. Again, odds ratios of 1 mean no association. And so we see in areas with low retailer density, protective impact on ease of access. So there, in areas with the flavored tobacco sales restriction, there was lower perceived access to e-cigarettes in areas with low retailer density. However, in high retailer density, their flavored tobacco sales restrictions were associated with greater use of e-cigarettes and with greater ease of access to e-cigarettes. So the tobacco environment really seems to play a role here. So in conclusion, we found that in areas of low retailer density, FTSRs had a protective impact on ease of access to e-cigarettes. And in areas with high retailer density, these policies were associated with an increase in ease of access and current use. And again, it's not that these policies don't work or that they cause e-cigarette use to increase. They need to be, they're just one piece of the overall plan to reduce youth e-cigarette use, which includes cessation tools, smoke-free places, prevention education. Okay, so now I'm going to compare, what we found to what others have found in Massachusetts. And so other researchers have looked at the following cities in Massachusetts. So Boston was not one of them. Boston's located here. And so these other cities are kind of surrounding cities in Boston, cities that surround Boston. So one study looked at the short-term impact of flavored tobacco restrictions on changes in youth tobacco use. And here's what they found looking at the outcome of any flavored tobacco product use. So they looked at this city, Lowell, which had a flavored tobacco sales restriction, and they compared it with a similar city, Malden, without a policy. And they found that any tobacco product use decreased in the city with a policy and increased in the city without a policy. And they reported that there's about 1.2 retailers per 1,000 adults. So these, they use like a slightly different tobacco retailer density measure, but these would also be considered low retailer density cities. So they found an impact. They found an association, a protective association between flavored tobacco sales restrictions and any use of a flavored tobacco product. In another very similar study, they looked at the longer term impact. So that study looked at about 6 months after the flavor policy. And in this study, they're looking at several years post-policy. So they looked at 2 cities with a policy, Salem and Attleboro, compared to Gloucester without a policy. So they found that any use of flavored tobacco product increased in each city, but it increased the most in the areas in the city without a policy. And again, these are all low density tobacco retailer. These cities all have a low tobacco retailer density. So, so this study also found an association between flavored tobacco sales restrictions and any use of a flavored product, a protective association. And this study had a qualitative portion, and I included several quotes here. So this student said it's 18 there in Rhode Island, 21 in Massachusetts, so I just go there. So they're referring to the Tobacco 21 law that increased the age to purchase tobacco from 18 to 21. So it was 21 in Massachusetts, and so they would just go to the nearby state, Rhode Island, to buy their tobacco products. And then another student said that another thing is that no matter how many laws are put in and how many restrictions, people are still doing it. There's always going to be a way to do it. So this person had the opinion that even though there's these policies, youth are still going to be able to find a way to get flavored tobacco products. So in these Massachusetts studies, local flavored tobacco sales restrictions had a protective impact on flavored tobacco use. And there were reports of traveling to nearby areas to obtain these products. Okay, now I'm going to talk about the impact of the California state flavored tobacco sales restriction. So this policy was passed in December 2022. Sometimes it's referred to as SB 793, and it bans the sale of flavored tobacco products in California. It includes most flavored tobacco products, except hookah is one of the main exceptions, so you can still buy flavored hookah products. So we looked at this through the Tobacco Cessation Policy Research Center, which is a community academic we have a lot of partners that are listed here. And the main goals of this center are to generate evidence for and implementation and to collaborate with community and policy stakeholders for optimizing impact. And so this project that I'm going to describe is an example of this, of collaborating with the community and the policy stakeholders. And another goal is to develop the pipeline of researchers for sustaining the TCPRC mission. And so a big goal is to focus on, or to encourage students to become involved. We have a gold fellowship and pilot grants. And Dr. Eliza Tong is the PI of this center. So this is an example of interacting with the community. And so I'm part of the Greater Sacramento Smoke and Tobacco Free Coalition, which is made up of a lot of different people who are interested in tobacco control. And so we heard that there were, through this group, we heard that there were challenges with enforcing SB 793. For example, there's people from the county that are in this coalition, and also enforcement officers that are in this coalition. And so they shared this data with us, looking at the percent of stores in Sacramento still selling flavored tobacco products in 2024. So this was almost, so if the ban was in 2022, it's, you know, almost 2 years after the policy, after the state level policy. And so in these two areas in Sacramento, Citrus Heights and Galt, we see that there's still a large portion of tobacco retailers that are selling these flavored tobacco products. So we created this policy brief where we synthesized data from different sources, including the California Youth Tobacco Survey and the CDC Foundation. They have this great website with e-cigarette sales data broken down by state that I'll show in a few slides. So you can see here we partnered with Jim Knox and Jen Graham-Lohano, and these were our political strategists on the project. And they shared with us that they really wanted to see state level data to show that this that you know there was a problem with enforcing this policy. So we created some figures to show this. So this is from the California Youth Tobacco Survey. And so we see that before and after the policy, there was very little change in current e-cigarette use in high school students. It went from 5.6 before the policy to 5.9 after. Also with ever e-cigarette use, very little change. And then we were also able to look specifically at flavored product use. So this is among high school students who used any of these products. The percent that used a flavored product did not change pre to post policy. And flavored use was really high among students, especially among vapes. And this is the sales data. So this is for California, looking at e-cigarette sales data by flavor type. And there's, you know, various different flavor types here. So this is when the state policy went into effect, and we see that there's a decrease in e-cigarette sales, but sales of all other flavors shown in yellow are still happening. So even though California, you know, prohibited the sale of flavored tobacco products, they're still happening here. And then we also see this new category of clear other cooling products are being introduced. And these are products introduced by the tobacco industry to kind of circumvent this policy. So here's some pictures of the policy. So these are what are called non-menthol products with cooling agents. So they're allowed to be sold. They're allowed to be sold. They're not considered menthol and outlaw and prohibited. But we can see here that they look very similar to the menthol products. So we shared this with our political strategists, and they delivered our policy brief to the governor. And the following two policies were passed. AB 3218 requires the Attorney General's office to post a list of unflavored tobacco products on its website, so stores know what flavors they're allowed to sell. And another one, SB 1230, authorizes the California Department of Tax and Fee Administration to seize illegal tobacco products. So before this policy, they were just allowed to go into stores and see if they were selling flavored products. Now they can seize them. So there's fewer available in the community. So now I'll talk about the state level, the impact of the state level policy in Massachusetts. And just for fun, here's some pictures from when I lived there. So this is a graph showing the percent of high school students in Massachusetts who currently use e-cigarettes. And I couldn't find a paper that looked at the impact of the state policy on youth tobacco use. It doesn't mean there's not one out there, it's just I couldn't find it. But so I used the this website. It's a really great website to generate data from the youth risk behavior survey. And you can look at all sorts of different outcomes, and they have almost all of the states. So, so this graph is showing Massachusetts compared to the United States. And here, Massachusetts passed their state policy in June 2020, which is about here. And we can see there was a decrease in e-cigarette use among high school students, but it happened in Massachusetts and the United States, a very similar decrease. So there doesn't seem to be much impact due to the policy. And this is current use. I also looked at ever use. And here there's a little bit more of a difference. So the United States is the solid line. No, Massachusetts is the solid line. And the United States is the dashed line. Again, the policy was implemented here. So we see that there was a little bit more of a decrease in Massachusetts for ever using an e-cigarette compared to the United States. So there may be an impact on ever e-cigarette use. And here's the Massachusetts data, e-cigarette sales data. And so they had a much larger decrease in their sales of e-cigarettes. And you can see all other flavors are in yellow. And whereas California is still selling flavored e-cigarettes, Massachusetts, their yellow bar is almost non-existent. So most of the sales are from the tobacco flavored e-cigarettes. So now I'll talk about some of the unintended consequences. So in Massachusetts, there's many states that are close by, like it's really easy to get to Rhode Island, Connecticut, New York, Vermont, New Hampshire, Maine are all really close. And so a lot of people were going to New Hampshire actually after the state level ban because cigarettes are the cheapest in New Hampshire. And online sales increased after both of the bans. So there was a study conducted in Massachusetts that looked at online e-cigarette vendors and found that 3/4 of them were non-compliant with the flavor ban. And then a study in California saw that online shopping for e-cigarettes increased after the California flavor ban. So people are still getting them online. So to conclude, we need to take the environment into account when we implement these flavored tobacco sales restrictions. We need to look at, the tobacco retailer density and the impact it may have on sales in nearby states. We also need a comprehensive effort to address e-cigarette use. So we need these policies. We also need policies to enforce smoke-free schools and smoke-free public places. And we need to enforce the policies. We also need to offer cessation tools for youth who are interested in quitting, and education for everybody about these policies, students, retailers, and the community. Thank you. That's all I have for today.
Thank you very much, Dr. Dove. That was a fascinating talk where you blended together your experience doing research and reading the literature, making a policy brief. Wow, in comparison of two states. If you in the audience would like to ask a question to Dr. Dove, you could, if you wanted to, type it into the chat. You could turn on your camera and actually raise your hand. You could turn on your camera and virtually raise your hand. You just use the raise hand button like that. So please take this opportunity to ask Dr. Dove some questions. I've got to ask Dr. Dove. Oh, I see a hand already. I'll come back to my question later. Michael, I see your hand up. Please ask Dr. Dove a question.
Oh, hi, Dr. Dove. Good to see you again. I remember working with you back in 2018. I'm not able to turn on my video that I know of, but I was just wondering I've heard that Zyn, Z-Y-N, is a very popular nicotine product. And I'm just wondering from your research and what you have seen, has that impact, it's a flavored tobacco product. What's the
Right,
impact you've seen?
right. So Zyn is kind of a new product, and it's a synthetic nicotine product. And it's becoming, it's used by youth. In California, there was an increase among high school students from 2023 to 2024 in the use of Zyn and oral nicotine pouches. So it's something that I think tobacco control researchers are really concerned about, and an example of that, oh, wow, record profits. Yeah, the tobacco industry, they're always coming up with new products designed to, keep people hooked to nicotine. And this is just kind of another example of that.
So is Zyn good for quitting? Like I've heard that's the goal, is to help people quit, but it actually makes people more addicted to this synthetic product than actually a nicotine product. But I'm far from any kind of expert. Just I've heard you can't find it in a lot of convenience stores because it's so popular.
Wow. Well, there's kind of it's not good for youth. Like youth, high school students, middle school students, shouldn't be using any form of nicotine. And in terms of adults, whether or not these products are able to help them quit, I'm not quite sure. The FDA has several smoking cessation, or has smoking cessation products, and it's not approved by the FDA as a smoking cessation product, because like you said, one outcome is that it could just keep you addicted to nicotine, whereas if you use a nicotine patch, you can lower your dose gradually. So the nicotine patch is designed to wean you off nicotine, whereas the pouch is not.
Thank you so much.
Thank you, Dr. Dove. Dr. Johnson, I see your hand up.
So forgive me if I missed a piece of this, but I had two questions, and I don't know that you're research would address either one directly, but I'm interested in hearing your very educated opinion. One is that back in the day, it was very clear that the tobacco companies were adding menthol to make these products more addictive. And then later on, we realized, oh, the menthol is actually an independent carcinogen. And so that those menthol cigarettes were more carcinogenic than regular cigarettes. Do we have good information about the flavors now, about addictive potential and the downstream health effects? Like, for example, I'll just be frank, because this is a horrible epidemic. My son, who's 20 years old and has been smoking a vape since he was probably 15, loves bubble gum. And that just seems, A, really disgusting to me, but B, like very, very bad for your lungs. Is there any evidence that you know of about addictive potential and carcinogenics?
Yeah, that's a good question. So as far as I know, e-cigarettes have not been determined to be carcinogenic. Let's see, but they are very addictive. And the flavors make it a lot easier to use them. So, they kind of mask some of the harshness and, I mean, a flavor like bubblegum sounds great, So they do make them easier to use. So maybe youth are using more of them and becoming more addicted. And in terms of like the specific flavorings, I think there was like diacetyl, which was involved in popcorn lung, may have been like detected in some smoke vapor, but I'm not quite sure about the carcinogenic effects of the flavorings, but that's a really good question and needs further research.
Super. Did
Thanks.
both the questions get answered, David?
Yeah, I think so. I think as best we can. In other words, that we don't quite know yet. I mean, the tobacco companies know, but we don't know yet. We're a little slower than they are. So to be determined.
Nice. And Dr. Dove, there's a question to you from Dr. Romano. Patrick?
Oh, yes. Hello, can you hear me?
Yes, loud and clear.
Okay. Yeah, so would a reasonable interpretation of your findings be that in an environment where these restrictions are passed by relatively small communities, where there's so much opportunity for contamination, if you will, or drift, and where the policies are, really can't be well understood by retailers because they vary so much from one municipality to another. In this kind of environment, would you agree that it's kind of hopeless to have local policies and we should really focus on statewide and national policies? Or do you still see some role for local policies? And if so, what is the role?
Yeah, I think I still see a role for local policies because a lot of times it's very difficult to pass a policy, and local policies are a little bit easier to pass than state level policies. So I know San Francisco was one of the first local comprehensive flavored tobacco sales restrictions, and then after San Francisco passed a local policy, then some of the surrounding cities in the Bay Area were able to pass policies because, they, showed that San Francisco could do it. And so they could do it as well. And then, so it builds momentum. And if you get enough local policies, then it's easier to adopt a state level policy. So I agree that the state level policy may be more impactful, but the local policies are helpful in getting that state level policy passed.
Yeah, it's an interesting point. So even if local policies don't work according to traditional outcome metrics, they may help smooth the way, if you will, towards more effective policies at the state or federal level, and maybe convince people that it's a reasonable thing to do. So interesting argument from the political science perspective.
Thank you, Dr. Romano. Again, if you would like to ask Dr. Dove a question, you can do so by typing it into the chat. You can turn on your camera and raise your hand. You cannot turn on your camera and do a virtual raising of the hand. I had a question for you, Dr. Dove. Honestly, how were you feeling on that first paper where you do the statistics and you find out that the people who were in the group that was supposed to improve actually got worse, and the people in the group that were supposed to get worse may have actually improved? How did you think about that as a researcher? You're experienced, you're well trained. Did you double check the programming, or did you know immediately there might be a missing variable? How did you think about this?
Yeah, just kind of thinking back, I've had some time to kind of get used to it, but yeah, it was kind of unsettling because we were kind of our hypothesis, because our results were opposite what our hypothesis was, and so it was very unsettling. And our paper was released around the time that they had that they were considering the state level ban. But we thought it was important for our research to be out there. And so I compared it with the Massachusetts study. But there's also other studies. Like there was a study that focused on the Los Angeles flavored tobacco sales restrictions, and they found no association in LA. So it's a little bit comforting that we weren't the only study to show no association. And then yeah, it really does seem like stores are still, at least in California, stores are still selling these products, which is a sign that there needs to be more enforcement. So evaluating the policies, no matter the outcome, it can provide helpful tools for like what to do next.
So if I'm understanding you right, there's a policy saying you can't sell this thing, and yet the stores are still selling the thing.
Yes, I heard an interesting our tobacco I always get the name wrong. Tobacco Cessation Policy Research Center recently had a summit where we had breakout groups in the afternoon, and we were talking about this subject, and there was somebody from Nevada County, and they were saying that their sheriff's office, their police department, was right next to a tobacco store. And they couldn't get the sheriff's department to enforce the tobacco store. The store was still selling flavored products. And their reasoning is that like there's all these other things going on, like opioids and just other things, like I guess more dangerous than selling flavored tobacco products that the police department is dealing with.
Do you think the way around that is to have like a bigger fine for doing it, and that could pay for the people to enforce it? Or do you think it would be making the research clearer that tobacco can kill a lot of people too?
Yeah, I think it's a combination of factors. I think there's currently fines, or the retailers can lose their license, which is maybe a bigger deterrent than a fine. And then emphasizing the harmfulness of these products, maybe more resources to enforce the products. this list, I'm kind of hopeful for this list to make, so then it's clear to the retailers which products they're allowed to sell, so maybe that will have an impact. Yeah, it's just a bunch of different factors that are influencing this.
Interesting. We've got time for one more question. If you'd like to ask Dr. Dove a question about her research, she talked to us about a couple articles she did. She's talked to us about a policy brief that she made. She referred to other information as well in the literature. Will, sorry, I see your hand. Please.
Hi, Dr. Dove, and hi, Dr. Hotch. So I was lucky enough to be involved as part of the advisory committee for a county tobacco use cessation program. And we were part of a smaller county, tended to be a little bit more conservative. And we were kind of running into some like different obstacles about thinking about which types of programs and interventions we should try to prioritize for our county. Dr. Dove, would you have like any ideas about just different interventions or programs that if you could be on our meetings with, you would recommend us to like think about and explore?
So you're talking about different ways for to help with youth cessation?
So I think the mandate for our program was to help tobacco cessation, but I think we had a pretty wide breadth and ability to navigate as long as we were, I think, shown to be reducing tobacco usage. And our primary focus was youth, so high school and below. If that makes sense. And at the LHJ level, so like the county health level.
Yeah. Yeah, that's great. It's great to hear that you're part of that. And I'd love to hear more about it. But there's a lot of existing resources that are free. So there's the Smokers Helpline, Kick It California. So you can call the helpline and they'll help you quit smoking. There's they're available in many different languages, and they also have programs focused on youth and vaping. There's a program called Why Vape. I think there's texting options also if you don't want to actually use a phone. A lot of counties have in-person tobacco cessation programs. I think UC Davis has one. What other cessation? And then the schools, there's programs designed for schools to use. So Why Vape could be used for schools. Stanford has a lot of resources. The Stanford Tobacco Prevention Toolkit has a lot of resources for helping students quit using vapes. Yeah, those are a few that I can think of off the top of my head.
That's helpful. Thank you so much.
Thank you for your question. I appreciate it. Dr. Dove, we've come to the end of our time. What is the one message you want us to remember from your talk today?
The one message is, I think that, these policies, they are, but they cannot, reduce youth tobacco use by themselves. They need enforcement. The policies need to be enforced. They're designed to encourage people to quit. So there needs to be cessation tools available and advertised for people to use. So it's this holistic approach that needs to be taken.
Super. Thank you very much. Unfortunately, we have run out of time, and I'd like to spend just a little bit of time thanking you, Dr. Dove, for presenting your research and your insights, and thanking everyone for showing up to today's seminar. We'll have another seminar next Wednesday, 12 noon. Thanks again, Dr. Dove, for sharing your insights with us.
Thank you. It's been great. Thank you.
You're welcome. If people want to follow up with you, can they send you email?
Yes, of course.
Excellent. Thanks, Dr. Dove, and thank you, everyone. Bye for now.